Even before the pandemic hit us about a year ago, the healthcare industry was reeling under a number of cost pressures and access and quality measures as well. In the US, it was always all about cost. And in countries like India, it's always been about access and access to good quality healthcare. Once the pandemic hit, it was like a double whammy. On one hand, there was an immense demand for healthcare professionals to step up to the plate and help the general population get through the crisis. On the other hand, financially, all the healthcare providers, whether it was primary care or tertiary care or even the hospitals, were really badly hit because people did not go and see their physicians from a primary care standpoint and put off elective surgeries until much later. The much later is 1 year down the road now, and we're only just starting to come back to normal. When you think about how these organizations have to survive, they've really got to figure out how to put down some basics in terms of process excellence and process improvement. It's really defining from a what's really core to the operations of a healthcare provider organization, whether it's in primary care or it's a multi specialty clinic or a set of clinics or a hospital, and then separate out what's core to them, which is really taking care of the patient, and what's non core or really is a chore, which could be anything from taking patient scheduling, it could be doing the revenue cycle management, it could be getting good, effective clinical documentation, and the list really goes on. This is the time where organizations have to step up and really take the bull by the horns, become more agile, because it's not just about surviving and thriving through the pandemic. These are things that are going to be here to stay and will help these companies be more nimble in the future. Think about it. Even after the pandemic, the costs in terms of sanitization, PPE kits, all of those have really become things that are here to stay, as well as our telehealth visits. So now's the time for organizations to really step up and take the plunge to become more cost conscious so they can really take care of the patients.